Hello, my name is Jacqueline Ho, and today we are talking about your pregnancy fitness guidelines. First off, if you're here, congratulations, you're pregnant and you're trying to figure out what workouts and exercises you can and cannot do. So I'm here to ease any worries that you have, kind of consolidate all the information out there, put it into one video for you to digest. A little bit about me, I have been a certified trainer and yoga instructor for about 15 years, since 2009. So whatever year it is you're watching this video, just kind of like do the math and we'll keep adding on the years to that. With that being said, I recently got trained in pre and postnatal coaching and I am pregnant myself. Can you see this little belly bump? I'm actually exactly 39 weeks today, so fully in it, the end of the third trimester. It's crazy. It's been a wild journey, and it's been really fun to use myself as an example, like what feels good, what doesn't feel good. And so it's really helped me shape where my views are coming from, in addition to all the training that I've done surrounding pre and postnatal training. So you're in good hands. I promise you that I will not lead you astray. If you have any questions, feel free. Feel free to pop them down below and I will answer them as I see them. And yeah, I don't know. It's such a beautiful, wonderful time. And I think that there's a lot of information out there. So I think together we're going to navigate it, and I'm going to help make sure that you are safe and healthy throughout this pregnancy. Sound good? So here are the 7 sections that we're going to be covering in this video. First off, must-dos before starting your prenatal program. Second, why you should work out during your pregnancy. Third, any contraindications or reasons you shouldn't work out during your pregnancy. 4, how hard can you work out? 5, how do I adjust my workouts if I need to? 6, general principles on what you can do fitness-wise during pregnancy. And 7, general principles on what you should probably avoid during pregnancy, fitness-related. And of course, that 8th bonus section are those questions we got from Instagram. So that's it. Click ahead to each section if there's one that's really calling out to you. But if this is your first dive into fitness and pregnancy, I really recommend watching this whole thing so that you have a really good grasp. Without further ado, let's get into it. Okay, so there's actually a beginning bonus section because I think this is really, really important before we dive into any of this. With pregnancy, this is your body. These are your decisions. This is your journey. So do what feels good for you. I'm going to be providing you a lot of advice and guidance based on scientific-based research and what I've learned, but at the end of the day, you know yourself best. Can you tap into your body's cues and really know how to listen to it and respond accordingly? Okay? That is the most important thing. The most common thing you'll hear is I'll give advice. For example, I'm going to talk about this later, but I'll say something like, avoid activities where you fall, because we don't want to cause any trauma to the baby or yourself. But you'll always hear someone say, well, I did this my entire pregnancy and I was totally fine. I skied the entire time, I mountain biked the entire time, and I'm good. Baby came out good, everybody was good. But on the flip side, there might be someone who maybe is not as good as a skier or mountain biker like myself, and I know that I have a risk of falling in those activities, so because I know my own history, will stay away from that. So know that someone will always say something, but you have to take this information and apply it to yourself accordingly, okay? That is first and foremost. Second, when it comes to fitness and pregnancy, I want you to not only just prioritize yourself, your well-being, your happiness and all that stuff, but make sure to choose movements that give you joy. Okay, so fitness is not supposed to be a punishment. We're not here to be like, oh, we have to do this because we must. Do you know what I mean? I want you to use movement throughout your pregnancy to make you feel better. So maybe you're not into a super crazy strength routine and you're like, I love dancing, I love yoga, I love XYZ. Do that as long as it's safe. You know what I mean? I want you to really listen to yourself, because when you prioritize your own happiness and your own well-being, that's going to translate into your pregnancy. If you're doing exercises or movements that stress you out, that's not going to feel good for you or baby. So really make sure you prioritize that. Also, remember it is okay to take it easy. And easy, I use even with like quotes because I don't even want to call it easy. We're growing bones in here. It's like a lot of work. So maybe you're used to more of an intense or rigorous schedule. Throughout your pregnancy, give yourself grace. Be kind to yourself because you don't want to overexert or bring yourself to a place where you do get stressed or you feel uncomfortable because that's just going to make everything else uncomfortable. Take it one day at a time. How your body feels today may not be how your body felt yesterday or how it will feel tomorrow. So you have to really be open to adjusting and making it appropriate for your current stage. One day you'll be like, oh, second trimester, I feel so good. I could literally like fly. And then the next day you're like, I want to throw up from 9 a.m. to 9 p.m. So be kind to yourself. You owe it to yourself. If you're someone who likes having schedules and plans like me, have a goal schedule, but be open to adjusting it as you need, okay? So that is my really quick, but not so quick, pre-section caveat, okay? So if you don't take anything else away from this video, take that away. All right, now let's really dive into it. First things first, must-dos before beginning your prenatal program. Without fail, please get yourself cleared by your doctor, midwife, or care provider before beginning any fitness program. So if you are someone who has worked out before, you're like, hey, I'm gonna keep working out, and they're like, great, your vitals look good, we have nothing to worry about, you're good to go. On the other hand, if you're like, I don't usually have like a normal routine, but I really wanna make sure I start working out, your doctor, midwife, care provider will be like, yeah, you look great, continue to do it, ease into it. They'll just give you that clearance, that peace of mind. Everyone has a different pregnancy journey. If you are high risk or experiencing any issues or contraindications, it's good to have that cleared first. Talk to your care provider. They'll give you that peace of mind. So do not skip that step, even if you're like, well, I mean, it's just like, whatever. Just do it real quick. It's just quick conversation. Then we can move on. Second, establish your goals. Why are you working out? What's the reason? What is the purpose? Having these clear goals laid out will help make the entire journey make so much more sense. It'll be a lot easier because you might wake up one day and you're like, ugh, I don't feel good. Okay, I have morning sickness, I have nausea, you know? But if you remember your goal and your goal was like, I want to work out to make sure I continue to prioritize myself and give myself a peace of mind. Well, you don't have to do a crazy strength workout that day to achieve those goals. You could go outside, get some fresh air, go for a walk your dog, hang out in the sun. Any movement that fulfills those goals is good. So that's why I want you to really think through and establish the goals that you have so that you can make each day better. It's just less stress that way. If you need help establishing some goals, some great ones for pregnancy include increasing aerobic endurance, because remember, labor is a marathon, not a sprint for most people. Second is building strength or maintaining strength. Third can be working and maintaining the pelvic floor integrity and the core integrity. So there are a lot of things that you can pick and choose from. Make sure that you choose something that really resonates with you. And those were some like concrete, like muscle body related ones, but you can always do things like I said earlier, peace of mind, breath work, keeping myself sane, being away from my phone. Any of those reasons qualify for goals during pregnancy. And last but not least, this is a bonus tip. If you're able to find a pelvic floor therapist now, I highly recommend it. It is quite a bit of an investment, but the pelvic floor really undergoes a lot of strain during pregnancy. You have this big weight just bearing down, and knowing how to control the pelvic floor muscles and keep them strong and also know when to relax them is super crucial. So meeting with a professional who can actually have an exam, talk you through it, and let you know if you're actively activating your pelvic floor, super, super helpful. Highly recommend it. I have one that I connected with in about my second trimester, and she's been with me through this whole journey. Great if I have any questions, and then she'll be there after I give birth to make sure that everything is still intact, and if not, we can work through it together. Section number 2, why you should work out during pregnancy. There are so many reasons that I'll tap to in just a second, but know that when it comes to movement, movement is always good. And again, it doesn't have to be this high, crazy, intense movement. It can be something as simple as walking, and that might be enough to get you into a different mental and head space, and your body will feel good, feel grateful for it. So ACOG, the American College of Obstetricians and Gynecologists, recommend doing at least 150 minutes of movement per week, broken up into at least 3 days. So 150 minutes is a great starting point, but you can take it or leave it however you need. Some people have really busy schedules, other people can fit in more, but whatever you do, they recommend movement. They say it's good for you, it's good for baby. Now you can start a fitness program at any time in your pregnancy. Don't wait till you're like, oh, I'll just wait till the end, or I don't feel good today and so I'm not gonna do anything for the next 9 months. You can start anytime, whether you were previously sedentary or if you're currently active and you want to continue. The thing is, you just have to make it work for you. So if you are previously sedentary and you're like, I think I need to start doing something, that's amazing, that's great. Start with something low-key, lightweight, ease into it, listen to your body. It doesn't have to be crazy, but know that you can start at any time. And there's lots of amazing fitness professionals online like myself or in person that you can talk to, and they can help guide you. And I'm going to give you as much information as I can here. I know I can't be with you in person, but you can always reach out and I can help you to the best of my abilities. All right, so this next part I have to read off because it's like so much information, but I want you to know it because it's really, really important. So the benefits of working out while pregnant, it's pretty wild because I think everyone's just like, yeah, no, it's good for you. But there's like actual research that shows it can lead to great things. And here are the concrete things. Benefits include reduced risk of gestational diabetes, preterm birth, gestational hypertension, postpartum recovery time, lower back pain, and urinary incontinence. So that's great. We want to help reduce the risk of that. It can also help with the prevention of excessive weight gain during pregnancy, symptoms of depression, postpartum weight retention, reduced risk of requiring C-section, reduced risk of musculoskeletal injury, and potential ability to cope with additional weight in the breasts and uterus. We all know that we're going to gain weight during pregnancy. It's very normal. It's like what's supposed to happen. But with the movement, it's going to help us have a better image of ourselves as we move forward. You can also help build strength and muscle mass, improve sleep, which is so important, reduce physical discomfort, improve psychological well-being. You can also reduce or alleviate nausea, fatigue, morning sickness, and headaches, which we love. So it varies from person to person, but you can just see that movement is good. It's going to help you feel great. Number 3, what are the contraindications and when do we need to stop working out? This is a valid question. It's not always rainbows and butterflies. Again, like I said, everyone has a different pregnancy. That's why you need to talk to your care provider, okay? With that being said, let's say you've been cleared and you start exercising and you're like, something doesn't feel right. Here are the contraindications and when you should stop. If you experience vaginal bleeding, regular or painful contractions, amniotic fluid leakage, shortness of breath before exertion, dizziness, severe sudden headaches, chest pain, extreme muscle weakness, calf pain, or swelling, that's when you need to stop immediately and then reach out to your care provider. You'll know you'll know. If you experience any of those things, something might be happening and you might want to talk to your care provider about that. But don't be scared. It's okay. Maybe it's nothing and that would be great. But we always want to err on the side of caution. Number 4, how hard can you work out? Everyone's greatest question. The number one thing to know here is we want to avoid overexertion. We want to avoid getting too hot and too out of breath, because what's going to happen is it's going to divert the blood away from the baby and then maybe potentially cause some unwanted side effects, okay? There's research on this. Feel free to tap into it if you would like to, but that is the general principle. Also, if you get to a point where you're working out too hard, like let's say you're doing a crazy HIIT workout, which I do not recommend, and you're working at a 10 out of 10, can't breathe, can't catch your breath, lightheaded, lightheaded, dizzy, all that stuff, we don't want that. Ultimately, it is up to you and what you would like to do. So you know your body best, like I've said, like I will always say, so listen to that. But it is recommended that you're not going above an 8.5 out of 10 on a perceived rate of exertion scale. So you want to still be able to talk a little bit, and you just don't want to be flat out on the floor, blacked out and dying. So if 1 is chilling, hanging out here on the couch, we're talking, and 10 is like, oh my God, I gave it everything in the tank, I have nothing left in the tank, I am no longer existing on this earth, you want to be at that 8.5. In addition, you want to make sure that your heart rate doesn't go above 90% of your maximum heart rate. So if you're really into numbers, you're going to take 220 minus your age, and that'll give you that maximum heart rate. Multiply that by 90%, and then that's where you should be for pregnancy. So make sure you manage that. If you have a heart rate monitor, Apple Watch, it'll tell you, and you'll feel it. When I'm working out, especially during pregnancy, I'm like, that's good. I feel good. Let's not go beyond that. You will be able to tell. When it comes to lifting, I want you to always reserve a couple of reps in the tank. So what this means is we're not doing 1 rep maxes. We're not going absolute wild on hitting a PR. We want to make sure that we're in about the 8 to 15 rep range. And when we get to that 8 or 15 rep, we feel like, oh, I could do maybe about 3 more and not feel strained. I repeat, not feel strained. So you just want to make sure you're in a comfortable range. You can still make gains. You can still get strong in that 18 to 15 rep range. We just want to make sure we're not overexerting. And when we do things like a 1 rep max or a 3 rep max lift, we're putting a lot of stress on our body and ultimately our baby. And then also we might be at risk for doing things like increasing that intra-abdominal pressure. So imagine yourself doing a barbell squat. If you can do 15 of a certain weight, barbell squat, feel good, that's great. We're in a good zone. But if you're doing 2 reps, 3 reps of a barbell squat, and that's your max, just imagine what might be happening, okay? We're pushing out, we're giving extra pressure on the abdominals, on the pelvic floor, might not be ready for it with the pelvic floor, and we might cause some side effects. So that's why I really want you to think about lifting as being in a comfortable, but maybe slightly pushed range, just like not too much. You really don't need to be lifting crazy, crazy, crazy heavy, but you can lift. Does that make sense? Okay, I have been lifting during this pregnancy. I've done all of it, squats, deadlifts, everything. It's been so much fun, but I just make sure to manage it because I don't want to create long-term side effects. Good? Good. When it comes to cardio, how hard can you work out? Same thing, 8.5 out of 10. Maybe no sprints, up to you. Really, remember, it's all about you. But you want to make sure you're able to have a little bit of talk, a little bit of yourself left in. I will say something with running. This varies, again, person to person. If you've been running a lot before pregnancy, keep doing it. You're probably fine. You might eventually need a belly band to make it more comfortable. If you've never run before, this might be a time where it might be uncomfortable to start running. And I'm not saying you can or cannot do it, but for example, I am a runner sporadically. So second trimester, I was like, oh, I feel like running again. And I did, and it didn't feel good. It just didn't feel good. And I've done half marathons. I've done them all. So I can do them. But I remember being like, oh, my belly doesn't feel good. Like it's a lot of pressure for me, the impact, I'm just not used to it because I haven't been practicing it. And so that's why it's really up to you. And I don't want to ever say you can or cannot like hardcore do or not do certain things. It really depends. So you want to take all these principles that you learned today and apply them to your situation. Okay? Okay. Number 5, how do you adjust your workouts? So let's say you have a workout routine you love and then you notice one day you're like, ooh, something feels different. This doesn't feel the same. So how can you fix it? First off, be okay with the adjustment. Adjusting, modifying, these are not bad things. We have a changing body, which means we need to change how we respond in order to keep ourselves safe, happy, healthy for the longest term possible. So, how do you respond? You can decrease the weight if you're working with weights. You can decrease the range of motion. You can change your breath pattern. Let's say if you're inhaling down, exhaling up, try reversing it. It's totally fine. Or if that's too much for the brain, just breathe. Just like breathe. Breathe through it. You can also try different rep ranges. Maybe it's just too many reps. That's simple. Take it down a notch. And then last but not least, maybe we stop doing the move altogether. There comes a time in pregnancy where you'll notice maybe this lunge position or maybe this balance position doesn't feel great. We take it out. There's always another move that is similar and more comfortable. So what are some common modifications that you might need to start thinking about? A very popular one is planks. You may be able to start off doing your typical plank, hands and feet, elbows and feet, and then at some point you'll notice that your core starts to cone. So what that means is right now I have like a round belly, and if I'm in a plank now at 39 weeks, my stomach will cone. So it'll kind of do like this shape. Can you see that? I can't tell if you can see that. But it's like that. So instead of here, it's like that. And what that just means is we have too much intra-abdominal pressure. Our core is not engaging how we want and need it to. So we take it down. Easy options for plank, pop down onto your knees. You can stay on your hands, or you can just come into tabletop position and move into a bird dog. So that's opposite hand, opposite leg comes out. I have workout videos on this. I will link them in the description below. So that's a common one. Another one, lying on your back. I'll go through this in just a second, but there comes a point when you lie on your back and you're like, oh, that makes me feel nauseated. So other options, again, come onto all fours, come to side lying. It depends what the exercise is. Another common modification is for core work. So at some point you're gonna stop doing crunches because this baby doesn't want to be crunched. You know what I mean? Let's not squish the baby. So modifications include, not lying on your back to do the crunches. You can come up and you can stay in a seated position, maybe doing things with one leg at a time, or using your arms to increase and decrease the weight throughout your core. So lots of options here. I want you to think about the principles, which we'll go through in just a second, and using that to make it work for you, okay? So I'm putting a lot of knowledge into your toolbox, and you pick out the tools when it's time. Section number 6, general principles on what is okay to do during pregnancy. First and foremost, movement is good. Remember, we went through this in our earlier sections. It is okay, it is good to move, it is good for your mental health, your well-being, but remember, choose things that make you happy. Choose things that make you feel safe and supported, and choose things where you feel good. So don't work out a certain type of workout if you leave it feeling like, what? Don't do that. That's not good. I want you to be happy when you move. So remember, that is the most important. You're already doing too much. There's so much going on in here. We don't need to add to the fire, okay? Things that you have done pre-pregnancy are great to continue during pregnancy. I had someone say that, they were doing this thing before pregnancy. They got really sick during the first trimester, and then what? Do they just pop back into it second trimester? Do they wait till the end? Pop back into it whenever you feel good and you want to, okay? You don't have to wait for anything, as in you don't have to wait till the baby's out. That's a long time. You might really miss this thing, whatever it is. So really listen to the things that bring you joy, and ease back into it. Give yourself grace. We do not have to be going 150% during pregnancy. We already are. So the movement should be a supplement and preparing us for that birth, for that labor, just making us feel good. Things you can do, you can lift. It is okay to lift. A lot of people have their feelings on it. You don't have to lift heavy. But keeping up that muscular endurance and strength is really going to be helpful for pregnancy. Highly recommend squats and upper body strength training because we're going to be holding baby soon. And you want to make sure you're evening out all of your muscles. So don't just work anteriorly, make sure you work posteriorly as well, because your whole body is one full machine. It's not just what you can see in the mirror. You can do core work. It is not going to look like your traditional crunches, but your core is made up of the front, which we can see. You have your obliques, your transverse abdominals here, and then you have your back. Anything supporting the spinal column is part of your core. So with that being said, there's so many things you can do. You can do standing core work, you can do tabletop, the bird dogs, lifting the knees to activate the transverse abdominals. There's so much you can do to still maintain the strength of your core, which is actually one of the most important things that you can do because you're growing and you're supporting weight here. This is different for your body. You want to make sure it is strong. And again, it's just not going to look like it did pre-pregnancy, but maybe it's going to be even stronger. Great exercises to do during pregnancy: squats, core work, strength training. Yoga is good for some mobility, breath work, meditation. All of it is good. Even dance away. Again, whatever brings you joy, you can do during pregnancy. Number 7, general principles of things to avoid during pregnancy. Now, as we start this section, I don't want you to be scared. Don't be worried. What I'm about to say is just to help you make some better informed decisions, okay? Now, besides the contraindications that we mentioned earlier, other things that we should be avoiding is overheating. So hot yoga, hot Pilates, running in the middle of summer in Las Vegas, not recommended. Have I done it? Yes, don't recommend it. Other things that can make you hot: jacuzzis, saunas. We want to keep the body temperature at a regulated level. There have been studies that show if you get too hot, you can be messing with baby's neural tube and there can be defects there. So it sounds scary, it sounds crazy. You'll meet people who are like, I did this my whole pregnancy, baby was fine. Totally good for you. This is the information. Take what you want, okay? Lots of questions on deep twisting. So twisting like this is totally fine. Okay, I'm stretching out my spine, it feels good. But deep twisting, like in a yoga class, hands to heart, twist all the way to the side, get the elbow to the knee, that's gonna just start feeling really uncomfortable. I physically cannot do that right now. So deep twisting eventually gets avoided. It really depends how you are growing through the pregnancy. It's your belly and my belly, it's gonna be different. It's just, that's the way it is. So at different points, we're gonna hit those times where we don't wanna be doing that deep twisting. Like I mentioned earlier, coning in the stomach. So stomach is round, coning, the belly comes forward. You'll see it. And this happens again in planks very commonly, or if you're even doing dead bug on the ground, where on your ground, opposite arm, opposite leg goes. Once we start being unable to activate the transverse abdominals, which is the deepest core muscle, that's when the coning happens. So we want to make sure we can still activate that. So modifying those moves accordingly. Next up, avoiding activities where you may fall. That's just the name of the game. We don't want to have any placental abruption. We don't want to hurt ourselves or baby. So again, skiing, mountain biking, parkour, I don't know. Anything where you feel like you may tip, maybe take a step back. That takes me to balancing exercises. Fortunately, my balance has been pretty much the same the whole pregnancy because I've focused on practicing it, but balancing can also lead to tipping and falling. So anything that's on one leg, maybe at some point you're gonna have to start adjusting a little bit by putting the leg down or holding onto something, but play that one by ear. You just want to make sure you don't fall. We don't want to fall. No one ever wants to fall, even when I'm not pregnant. Next up is avoiding too much intra-abdominal pressure. So again, belly is growing, a lot of pressure happening here. We want to make sure we avoid more pressure, okay? Because that's going to put strain on our pelvic floor and our abdominals. We want to avoid the Valsalva maneuver, which is where you inhale and then as you exhale, your nose and your mouth are closed. So you're like, do you know what I mean? Okay, it's like when you're lifting, a lot of people do that Valsalva maneuver. So we want to avoid that because that really increases the intra-abdominal pressure, and that is not going to feel good, my friends. Next up, lying on your back. This happens differently for everybody at different stages in their pregnancy. I feel like the most common thing you hear is like, don't lie on your back, like pregnancy, don't lie on your back. And I was scared. Like, they're like, second trimester, just stop. And I talked to my midwife and she's like, no, you're good. You will feel exactly when you need to stop lying on your back. Your body will wake you up if you're sleeping. And if you're moving, working out or whatever, you'll start to feel weird. And I can attest to this. For me, it didn't happen until like mid-third trimester. So I feel like I was able to go a little bit longer. Who knows why? Everybody's different. But because of that, I was able to do more exercise on my back, like bench press and such. But as soon as it didn't feel good, we moved on. We started doing incline chest presses or taking something else to replace it with. Ultimately, the lying on the back thing has to come back to the blood flow between you and your baby. And when your baby grows bigger, it can sit on a main artery, a main vein, and kind of restrict that blood flow between both of you guys and not feel great. So that is the story of lying on your back. So yeah, don't be scared. Your body will really know how to respond and listen for these cues. So just listen for them. Lastly, we want to avoid overstretching. You're going to start getting more of this hormone called relaxin, which makes your joints super stretchy, which is really cool for the splits, but can be really hard. So you want to just make sure that you're very mindful of not going too far because you'll feel maybe a strain or you'll pull something, and once it's pulled, it's really not fun. All fixable, of course, but just be mindful that if you're noticing you can go really low in like a yoga pose, maybe just like ease out just a little bit, just because we don't want to push it to the max. Now is not the time for max. So those are the general principles on things that you want to avoid. Again, if you have any questions, leave them in the comments below. There's a lot of stuff that they say pregnant women cannot do, should not do. So let's talk about it. I like to approach things from a scientific-based background with fitness, and we can talk through it together. Why was this said? What is the story behind it? Is because we're worried about blood flow, about safety to mom? What is it? And we can talk it all out. I believe I hit everything, but if I forgot anything, I will also pop it into the description. All right, and our bonus section, number 8. These are the questions I got from Instagram, and I thought they were so good I wanted to address them. So the first one we had is, what have been your favorite exercises throughout pregnancy? I love this question because I had such a really great time figuring out my own routine. I did a schedule where I tried to hit 5 times a week, 4 times if I was really tired, and trust me, there were tired times in there. I did a chest and tries day, back and bis day, leg day, and then I had a swim day and a yoga day. And with each of those days, besides a swim day, I would also include time on the Stairmaster because I liked the incline. I loved it, and the Stairmaster's never filled at the gym, so I just like to go to the place where I know I can go. And some of my favorite exercises have been squats. Really have worked hard on my squats, worked hard on my bench press, and then it had to move to that incline press as I mentioned earlier. And then my back workouts, like the lat pull downs and stuff. I was doing pull-ups for a second, assisted, of course, because it's weird to have to increase pull-ups, but you're also like increased belly weight, so it's like weird. They all have been fun. I felt very strong and empowered, and that is the goal for you as well. But squats, highly recommend any form or variation of them. Good. Next question I like, where do you get your information for all of this? What are some resources you recommend? So I didn't just pull out all of this from thin air. Like I said, I've been trained in pre-postnatal coaching. I have my certified personal trainer certification, and I am a certified group fitness instructor, and I have my yoga certification. So I've pulled a lot of knowledge from a lot of places, but ultimately there is a wonderful, very well in-depth textbook that I have from the pre-postnatal program that I attribute to a lot. They have great resources in there. So this is not just Googled stuff. This is highly researched, all that good stuff. But when I do need to reference my information, I usually go to ACOG, which is the American College of Obstetricians and Gynecologists. They have great scientific backed information there. Or I just make sure I'm looking at a scientific website. So not just some random stuff, because there's lots of random stuff out there. And this last question I really loved. Someone said, I was advised not to do any jumping HIIT. What is your recommendation? So HIIT is high intensity interval training. And from what we've learned through our day together today, is that we don't want to get to that 10 out of 10 mark, right? We don't want to divert the blood away from the baby. So how does jumping HIIT get into that equation? The HIIT part is going to make you probably get to a 10 out of 10. If you can keep it under a 10 out of 10 in that 8.5 range, that's good. But if you're going too high, probably not recommended. The jumping part, this is interesting because in the beginning, when you're really early in your first trimester, the running feels good, the jumping feels good. It doesn't feel like there's much happening. You can almost feel like you're doing the same workouts you've been doing. But as you progress, the jumping can just put a lot of strain on your ligaments, especially your pelvic floor, your cervix, and it's just not going to feel good. So the long answer, or the short answer is, can you do jumping? You could. Do you want to do jumping? Maybe not, because it won't feel good. Things like even box jumps, there's a tendency to possibly fall. You don't want that either. So the jumping HIIT really is a person-by-person basis, but from a scientific point of view and what that's doing to your body as it's changing, that is what's happening, okay? So those were a couple of my favorite questions from Instagram. If you have more questions, pop them down in the comments below and I will get to them. Do not worry. If I can't get to them or if I don't feel like I have the expertise for it, I might direct you to someone who knows more. Maybe it's a PT, physical therapist, or your doctor. If you have any other questions, pop them down in the comments below and I will do my best to answer them. And yeah, that's it. I wish you the best on your pregnancy journey. I hope I answered all of your questions, alleviated any issues that you might have or concerns that you might have. And I'm very grateful that you trusted to be here with me today so that we could talk through it. I think I got everything, but I know that I'm going to be turning off this video and being like, I forgot to say this thing. It's going to drive me crazy. But I think that was the majority of it. Remember, the biggest takeaway is if you are moving during your pregnancy, choose something that makes you happy, empowered, joyful, okay? That is the goal. And the rest of this is all for your toolbox to pull out when you need. Other than that, best of luck with your journey. All of my first, second, and third trimester workout videos are available online on YouTube now, so we can work out together as you progress. 39 weeks, I'm almost ready to have this baby, so thank you for being here with me, and we'll see you soon. Bye.